Thank you, Mary. Thank you, everyone. Photobiomodulation, which is red light therapy, it is rapidly becoming a part of mainstream medicine and mainstream wellness. It is truly revolutionizing the way we think of health and the way we think of treating patients. Tonight, even though we're only here for an hour between the presentation and questions, somebody in the world is going to have their lives saved by PBM. Someone in this world are going to be feeling better and well because of PBM. Somewhere in the world, military units are in better shape because of PBM. Somewhere in the world, a world-class athlete is improving their performance because of PBM. It is truly a revolutionary device and approach that is becoming not only the future of medicine, but the present of medicine. So, what is red light really? It was discovered in 1967 by Dr. Andre Mester in Budapest. What he did was, this was early on in the 60s, that lasers were considered a new thing, because they were discovered in 62. And he wanted to check to see if lasers cause cancer. He shaved a whole bunch of mice. Half of them he treated with this red light, and half of them he didn't. And no cancer. But what he found was that the mice that were treated with the red light, their hair growth came back, because he shaved them all, like 3 times faster. And so he said, something interesting is going on here. And so he called it photobiostimulation at the time. Berlin Wall falls in 1989, and all of his research comes into the West. So as we start to move into the Western world, the dental profession, the veterinary profession, and the chiropractic profession start to embrace red light or PBM. So today, we can look back over literally going back the last 20, 30 years, over 100 million patients have been treated in clinical settings. We're not talking about the consumer stuff. We'll talk about that later. We're not talking about home use. We're talking about actual clinical settings. Over 100 million patients worldwide have been treated without one single side effect. You can't even get that from taking a vitamin C pill. So the key is that it's a natural process helping a natural process. And it is that safe. The other part is that as PBM has moved into the West, we have had an amazing array of randomly controlled clinical trials. We've had an amazing amount of actual clinical studies published, over 11,000. In fact, every month, about 83 new papers are published worldwide. So this is a very vibrant, active, scientific environment. And some of the best journals, the Lancet, the New England Journal of Medicine, JAMA, and even Nature. It's amazing what they've come up with. It all boils down to who we are and what happens in our body. The mitochondria is embedded in all of our cells. We have 32 trillion cells in our body. And the mitochondria, literally tens of thousands of mitochondria are in each cell. And they're basically this small little engine that takes nutrients and light into our system and turns it into the energy that makes us us. And if something happens that stops that process or gums up that process or slows that process, then any number of issues start to happen to our body. In fact, 80% of what ails us, ages us, or injures us has something to do with cellular function. So how does this all tie together? We are warm-blooded plants. We basically change color in the sun. We love our vitamin D and need our vitamin D. And on a sunny day, we're happier. So when you look at the molecular level and even at the subatomic level, the process by which nutrients come into our body, into our cells, and light comes into our body and comes into our cells is identical to photosynthesis. So the moment that you start to realize that when we're out there in the sun, we're getting this wide spectrum of the light spectrum coming into our body, if we take one part of that light spectrum red and infrared, which is basically 500 to about 1100 nanometers, and intensify that particular part of the light spectrum, wonderful things start to happen to our body. I like to think of it, if you want to do like a Spock thing, that the electron transport chain, or the photosynthesis chain for plants, is basically a four-part process where different nutrients come in and swapping of ions, molecules come and go. You're basically creating this electron transport chain, and literally at the electron microscope level, you see this fifth thing actually spinning. Literally a microscopic machine that is powering the mitochondria, that's powering the cell. What happens is, again, if we're injured, aging, or sick, they close up. This whole process gets disrupted, and that's called inflammation. That's why things swell, is because these things close up and swell. You put this red light into the mix, they open back up. That's the power of the photobiomodulation. The key is that when you're talking about the molecular level, subatomic level, it doesn't take that much of a tweak to go from this to that. Looking at all the devices, because this is clearly delivered by devices. The first one is consumer devices. If you go on to Amazon and type in red light therapy or red light device, 80,000 are listed. And they are the good, the bad, and the ugly. Most of them are China knockoffs. Most of them overpromise, underdeliver. And that's one of our challenges as a PBM movement, is that people will buy one of these things for 50 bucks or 200 bucks, use it and say it didn't work. Well, the reason is you're getting what you're paying for. Last year, the Defense Department actually went and started to assess various devices, the medical grade, which we're going to be focusing on today, and the consumer grade. And a lot of us probably have seen the Tommy Copper ads. They're everywhere. Tommy Copper, when they're red light, the Defense Department documented only 34% delivered, 34% of their promised dosage is being delivered. So we're talking about a lot of false advertising out there, so buyer beware. But the other part is a lot of people misuse these red lights, just like the middle part there. Red light has to go directly to the skin. It cannot go through clothing. Number two, the moment you move from directly on you to further away, the entire beam disbursement plummets, the dosage plummets. So to have an attractive woman in a leotard 2 feet from a thing, she's getting nothing. So it's good for advertising, but that's about it. But it does grow hair. I mean, the mice grow hair. You can grow hair. Those actually work. And a lot of people using the face mask for small cosmetic purposes of wrinkles, it will help. So, I mean, there is a role for consumer-grade red light. But we're going to spend time this evening talking about the medical ones. The three things here, the light bed, the handheld, and the helmets, they're all over here at the Wellness Center, as well as other devices that are there. There's right now, you have people who are developing wearables and wraps, and this is just an example. An Israeli company is creating a PBM device that you swallow to use for colitis. Goes through the body in 3 days. And so it's so all of the different ways to deliver light either to the outside of the body, which is basically 5 to 8 centimeters penetration, to the inside of the body. There's a Swiss company that's got has a catheter probe that's trying to treat hearts and other parts of the body. So there's many, many ways to deliver the light into us so we fully benefit. And those benefits are many. And we're going to go through each one of these. That PBM does, in fact, heal. If you have an acute condition, it will heal it. If you have a degenerative condition, it will slow it. And so what we'll be talking about is the way these different devices treat the body to either heal it completely or slow down the whatever is ailing you, like a Parkinson's. The first great success we've had is in the whole area of cancer. Not treating cancer and curing cancer, but if you are going through, or a friend of yours, a loved one, is going through heavy chemotherapy, in many cases, they're going to be developing sores in the throat and in the mouth. In the worst case scenario, it's called oral mucositis, where literally you can no longer swallow. And you have to either have a feeding tube or suspend cancer therapy, and of course cancer then advances. What we found, and this goes back a number of years, study after study, clinical trial after clinical trial, if you pre-treat the esophagus, the mouth, with red light, you prevent oral mucositis from happening. You prevent the sores. It is so safe and is so proven that over here at Morgantown, it's a standard of care. It's a standard of care. The big one is University of Pittsburgh Medical Center. They've done over 3,000 patients up there over the last 10 plus years. The key is that this is the first of all the different applications we're going to be talking about that has actually become a standard of care, actually is standard order sets at these cancer centers. The best one is St. Jude. Everyone knows about St. Jude. It is considered so safe that they are treating all their pediatric cancer patients with red light. And what's interesting is, because children, 3-year-old, 4-year-old, so they're not freaked out by it, they've actually created a probe that looks like a popsicle, and it goes into the child's mouth, and they suck on it, and the light goes into the mouth and into the throat, and all the side effects go away. Another thing is, and this is where we go from the medical side to the management side of the house. In Brazil, a couple years ago, they looked at the whole issue of PBM pre-treating cancer patients. And they found that if you pre-treat a cancer patient and prevent all the side effects of the chemotherapy, it's a 73% savings in overall cost of care for that patient. So when you start to look at people worrying about the cost of health, cost of care, this makes economic sense besides making scientific and medical sense. One issue that's close to our heart is, of course, what happens here in West Virginia. We, unfortunately, remain the epicenter of the opioid crisis and have for many years. And how do we deal with opioids both on two fronts? Preventing their use in the first place, but also if somebody has that substance use disorder or addiction, how do we wean them from it? Because traditional rehab processes tend to not work and tend to not last. What we've found is that PBM takes care of that. So a key part to this is the whole issue of how mitochondria affects mood. If the mitochondria, if that process gums up and things start to fall apart, any number of issues start to happen that ripple into our psychology, our emotional state, and therefore create susceptibility for opioids on one front or the full commitment and addiction to opioids on the other. First thing is pain management. What we've found is that if you are having pain, whether it's a broken ankle or tennis elbow or work too hard in the yard or whatever else, or something much severe like a whiplash or some other thing from a car accident, PBM takes care of that pain. It manages that pain far better than any kind of drugs. Good example, again, because we're with the PBM Foundation, I have about a dozen of these devices at the house. A month ago, I stumbled across my dog, jammed my thumb into the side of the door, and in the past, I just put ice and aspirin on it. Instead, I pulled out what we'll call the Kerber device, the handheld, put it on it. 5 minutes later, moved my thumb, no more pain. So the thing is that these things are kind of news you can use. These are things that we can do. Another aspect of photobiomodulation is two things. Number one, there's a cumulative effect. If you use it more often, it builds up in the body, it builds the momentum of rebuilding the cell. The second piece is there's a residual effect. If you stop using it, it will continue, the momentum of help repairing that cell will continue on. So in this case, this was a crossover study where someone was doing sham and PBM, and then halfway through they switched around. And look what happens. When they switch, people who had the PBM continue to get the benefits of it, and then the people who were in the sham, they catch up. Some of these are very powerful studies that, again, prove that this stuff is real and the science behind it is real. Again, Shepherd is at the center of some of this incredible research. 5 years ago, Schiffer at Harvard Medical realized that, again, drug rehabilitation fails. 70% fail rate, people graduate from rehab and then lapse. So he found that if you added as an adjunct the PBM to normal rehabilitation processes, it basically ups the ante, basically increases the success rate, speeds the success rate, and retains the success rate. And so this, again, in this case, dealing with not only the pain side of it, but the psychological side of it, the neurological side of it, you're able to wean the person and ease the person in the weaning process. Just last year, Dr. Jenny Flora locally did the same test with a large cadre here at Shepherd University, and again proved the same thing that Shepherd did a few years ago. Again, a major watershed study that is allowing us to look at where do we go next with opioids and addiction. And thanks to here at Shepherd University, our own studies have shown exactly, proved once again that PBM does work. So here's part of that study where basically opioids craving, how much, look at the drop in cravings versus the people who are not getting PBM. Very powerful. And between these studies and the other studies dealing with pain management, what we have is the Center for Disease Control 2 years ago, actually 3 years ago now, actually formally recommended that every few years they update their opioid prescription guidelines. So in their prescription guidelines from 2022, they actually said that if you have pain, don't use opioids at all, use light. Huge breakthrough. It took us years of testimony and sharing scientific to get the CDC to come up with this, but that is how we're breaking through into the new mainstream. Another thing that happened here at Shepherd, a lot of us had COVID. I had COVID, my wife had COVID. And one part of COVID for people who actually died of COVID was the acute respiratory disorder syndrome, ARDS, where basically your lungs fill and fibers start to happen in the muscles and you basically choke to death. A couple hospitals in Boston and Dr. Bob Bowen over at the Martinsburg Hospital realized that if you put PBM on your chest, basically from the collarbone to the diaphragm, each side of the sternum, and basically take, again, a handheld 1, 2, 3, 4, 1, 2, 3, 4, about 4 minutes each, you can prevent our ARDS. So we saved lives in the early stages of the COVID with PBM in Boston and here in Martinsburg. Another part of COVID was long COVID, and a number of people had brain fog. And again, what we found, and this again was something done by Dr. Bowen, is that if you put either the bed or a head helmet on to deal with the brain fog, the brain fires up. In this case, you can see the brain normally, and then what happens when after, this is only 12 minutes, how much the brain fires up. And then he also did a number of tests dealing with speed and accuracy of different mental acuities. And we're talking, doubling, tripling the scores on these things. So a person who is one of our local heroes, Ann Abernathy, she's been in six Olympics. She's one of the top archers in the world. She had brain fog, and she went on into the study with Bowen. And had she gone through the standard medical, she would have been drug screened out of Olympic competition and drug screened out of world competition. Instead, she used the helmet and as well as the bed, and she's still world champion to this day. Again, had she not used PBM, she would have had her brain fog, and if she'd followed normal doctor's advice, she would have been out of competition, world competition. Another area, this is hopefully haven't eaten too much. One of the big issues for a lot of people, especially those who are getting their type 2 diabetes, is you get these ulcers, horrible ulcers, that don't heal. And what happens is that in a lot of cases, and it can get far worse looking than this, you get your foot amputated. What we found is that because PBM is literally rebuilding tissues at the molecular level, and also increasing the blood flow to the area. In this case, you can see this is only 7 weeks apart. That unhealing ulcer starts to heal. In fact, a couple weeks later, it was gone completely. So we're saving feet, not just lives. We're saving feet. Another one. This is a venous ulcer. And once again, you're looking at something pretty bad. And the traditional process is Santil and other abrasive issues, very painful, 6 months to a year to heal it. But here, if you look at the chart, how much faster, how much more shrinkage there is by using PBM versus normal Santil and other traditional approaches. Another one of our colleagues, this is a person who actually runs a major dental school in the Southwest. She had a compound fracture. And so she put on, in this case, this is a Thor device, and 5 weeks later, you can't even see the scar. In fact, what we're finding is that a lot of people who are dealing with burn victims the same way, that if you get a horrible third-degree burn, and you have to have all sorts of treatments and pain and all the rest, and they're being able to say that if someone gets burned on one hand, 5, 6 weeks later, you can't tell which hand was burned. So it's just amazing stuff. So now we move from sort of the skin area to now the internal neurological area. So as you start to look, and this is started in Boston and in our Salt Lake City and Denver veterans hospitals, they've been treating traumatic brain injury. And again, unfortunately, there's a lot of soldiers that not only in the battlefield because of roadside bombs get their head totally jarred from an explosion, but even in normal occupational environments where you have artillery squads who are out there getting blast exposure, even though it's not in a combat setting but a training setting, they're getting traumatic brain injury. And it's horrible. And this is where a lot of our veterans commit suicide, because they start giving them drugs to try to mitigate the traumatic brain injury, the neurological synapses that aren't working anymore. And what happens is that they get addicted to the drug, and as with any addiction, more and more drugs, they have a sort of literally disconnected from reality, and they kill themselves. I mean, unfortunately, dozens and dozens a day now. So what we found is that when we did these studies at Boston, Denver, and Salt Lake City, it was so successful that the Veterans Administration has officially recommended that this is the treatment for traumatic brain injury, not the drugs. So we are, once again, saving lives. Unfortunately, like many other parts of the institutions of health, we're only in 17 VA hospitals, 170 are there. So a lot of our challenge as we move forward is we've got these recommendations, we have the science proven, but they are not being fully implemented. There's so much institutional inertia, and people still saying, well, this must be snake oil because how can it work on cancer prevention on one front and traumatic brain injury on another and a sprained ankle on the third? Because medical science is so stovepiped. I mean, they only will look at one thing or another. They don't recognize that, again, 80% of what ails us, injures us, ages us is cellular function. If you do one thing really well, which PBM does, it can cut across all those disciplines. That's a huge revolutionary thinking, which most medical people are just not ready to cross that bridge. So that's our great challenge. Another area, and this is not one of our adjunct faculty here, she's Ann Liebert, who's out of Sydney. What she's found is on the Parkinson's front. We're finding that people who had long COVID are more susceptible to Parkinson's. There's other issues coming forward that's finding that there's a big uptick in Parkinson's out there in the world. And what she's found is, once again, red light takes care of the Parkinson's. It actually stops the progress and reverses it. So she and I were in India earlier this year, and Prime Minister Modi literally honored her for her breakthrough research. So once again, Shepherd and an adjunct faculty at Shepherd is getting recognition on a global scale. One other area which has also literally just happened in less than a year is the whole area that as people age, and we obviously have a huge aging population, you get into macular degeneration, age-related macular degeneration. If you have the wet kind, you can get the injections, and my dad had that for a number of years, and injections help. But if you have the dry kind, there was absolutely no way to treat it. You basically have a 5-year glide path to blindness, and if you're in your 80s, you're not going to learn Braille. Your life is effectively over. So what we found is this one incredible company up in Seattle, Lumithera. It took years and millions of dollars, but they went through all the hoops that the Food and Drug Administration threw in front of them, and actually were the first ones to get a full indication for use of PBM being used to stop the forward progress of age-related macular degeneration, dry, and even begin to reverse it. So here's an example that age-related macular degeneration is a thickening of the back part of the eye. And in this case, you can see in 3 months of therapy, it shrunk that thickening. So it's an amazing opportunity here to save sight and therefore effectively save lives. Now we're looking at the healthy side of the house. That PBM does a lot of things to make people well, but what about people who are well? And what we found is that it can help on several fronts. If you're a healthy person and you're using the red light, whether it's a handheld, a helmet, or a bed, wrap or whatever else, that it's going to improve your stamina, it's going to improve endurance, it's going to improve your performance, and it's going to improve recovery. So let's say that you're out there with your squad doing maneuvers, and you come back in after a long hike or an arduous set of exercises, and the next morning you wake up and you're just really not wanting to do 100% the next day. If you're pre-treating with the bed or some other aspect of delivering PBM, you're going to, number one, march further, you're going to be more alert, and the next morning when you wake up, you're going to be ready to go again. And so in this case, what we call warfighter effectiveness, that it's every year there's a major conference in June, and this year, like a full third of the people who presented were talking about some aspect of how red light is improving warfighter performance, warfighter effectiveness, and deployability, which is huge. And right now, every one of our SEAL units are using PBM as part of their conditioning. Every one of our special forces within the Army and all of our pilots, NATO pilots in Italy, are all using this. The Israeli Defense Forces are using it. Other militaries around the world. It's becoming an integral part of the warfighter environment and health environment. Same thing's going for athletes. back in 2016, in a relationship with Nike, we took several of the Novathor beds down to the Brazil games and the summer games. And the International Olympic Committee actually did a formal ruling. They said, is this performance enhancing as a drug or something, and therefore banning it? They said, no, it's like a bucket of ice or a whirlpool. It is a natural process helping a natural process. So what they did was they said, it is allowable in an Olympic competition. And so nowadays, literally every team that was sitting out there in Paris had some form of red light, PBM, as part of their conditioning routine. Also, for those people who are runners and they maybe do 3 heats a day, if they go into a bed or into some other kind of wearable before the first run, and then they go back into it after that first run, they're good to go for the second run or the third run as if it was the first run of the day. So performance is improving, endurance is improving, and most importantly, recovery is improving. Every major NFL team uses red light. Every single rugby team, every single Australian rules football, NBA, you name it, everybody is using it now. And so that's another great part to this whole issue. And so for those of us who may be using the Wellness Center over here, this is what helps us. If you look at these different processes, again, whether it's working out in the weight room at the Wellness Center, whether it's doing your gardening at home, that all these different processes from cryotherapy, PBM, that the one that reduces the soreness faster is PBM by itself. So this is, again, like news we can use. So once again, looking at how it drops it down. Celebrities use this. Right now, Tom Cruise has 7 of these beds, Novathor beds, in all of his different houses. Bezos has 9 of these beds. He's got one on every one of his yachts. He has the most interesting one is Wahlberg. Because, we're talking all, like in the case of Cruise and Wahlberg, aging action heroes. But what Wahlberg did is something interesting. He has a mobile version of a Novathor. He takes it on all the location shoots for all of his action movies, and he pre-treats his entire stunt group. So all of his stunt people limber up in the bed before they go on to set. And he's been able to reduce on-site injuries by 30%. So before they're leaping off of buildings and fighting and tussling, that because they've been pre-limbered and pre-conditioned, they've been able to, and of course time is money in location shoots. So this is a big win financially, but it's also a big win for the health of his stunt team. So let's shift over to the animals. Ironically, because veterinarians have embraced PBM long ago, your cat and dog have more access to PBM than you do. And if you go to places like the Shenandoah Vet down the road here in Martinsburg, they use a K laser, and it helps on many fronts. It helps on hip dysplasia, it helps on arthritis, and it helps on renal failure on cats. Because again, the 5 to 8 centimeter penetration, they can get all the way to the kidneys. But the key is that, all of us probably have been pet parents at some point, and one of the tragic things is to watch that pet suffer, to watch the hips go out, to watch them stiffen up, and they can't move anymore, and life isn't that much fun, and you have to euthanize. We've been able to document, especially there's this great veterinarian up in Boston, that 2 to 3 additional years of quality life if you pre-treat an aging animal. We're doing it on our dog right now. We had 2 cats that were having arthritis issues, and in both cases, they were running around like 6-year-olds, even though they were 20 years old for the last couple of years of their life. So it is a wonderful thing to use for your animals. Again, in this case, degenerative disc for dogs. And another area which is just starting up is equine. That what we've been able to find is that, and we have a company that's working now with the horse racing circuit out in Asia, that if you put a horse blanket lined with LEDs over a horse, the conditioning's better, the injury level goes down, and so it's, and the dressage network, there's been a couple minor royals in England that have been using PBM on their horses for dressage for about 10 years. So again, the world of equine has a great opportunity here to basically bring life and quality of life to these wonderful animals. So where are we going into the future? The first thing is we're shaping the future. Places like Shepherd with the nursing school, which is one of the first nursing schools in the world that requires PBM knowledge as part of their degree programs. And then you have Montpellier University in France, the oldest medical school in Europe, that has had their own medical program for many years, and they're exploring how to partner here at Shepherd to bring their curriculum into our campus. So you have, we're seeding the clouds, so to speak, that we're basically making sure that the next generation of doctors, next generation of medical professionals and general nurses, that when they're in the room, whether it's the emergency room or the surgery room, that they're going to be able to say, hey, why aren't we using red light on this? That we're trying to seed the clouds. And again, Shepherd is one of the closest to that. Where are we public policy-wise? The beauty is that PBM and the whole openness to these medical devices has been very nonpartisan. I work as closely with Senator Warren's office as Senator Joni Ernst's office, and you can't get further apart than that in the political spectrum, but they are both so concerned about blast injury exposure and how red light can help that we're working hand in glove with both sides of the aisle. But the Make America Healthy Again movement has become uniquely focused on red light. Pretty much all of their leadership from Kennedy on down use red light right now. And so the result is that this whole philosophy of big pharma not being what it should, is being the bad guys, and the openness to medical innovation, the openness to other things that holistically help people, as opposed to always popping a pill or taking a syringe or an EpiPen, is wide open. So the result is that the Make America Healthy Again movement with Kennedy and his team at HHS, with Collins and his team at the Veterans Administration, with the folks at DOD, that we are getting a new openness to this whole process. Right now, the MAHA movement is quarterly having national meetings, and in every one of these national meetings on a quarterly basis, we are now having one or more red light panels. Every month, there is now a meeting, which I attend, of the MAHA leadership in Washington, and once again, everybody there is looking at not, does red light work? They all know it works. They're looking at how do we promote red light. This is a huge sea change from 10 years ago where people were going, what in the world is this stuff? Isn't it just snake oil? So the beauty is that we are getting and gaining ground every day. One of our great goals is reimbursement. Right now, except for about 2/3 of Blue Cross Blue Shield affiliates that cover treatment for oral mucositis in the cancer area, we have basically no private insurance coverage for PBM treatments. Center for Disease, or the Center for Medicaid Medicare Services, the Medicare side, we're trying to once again get Medicare coverage. This is going to take, it's been taking a while. We're hoping it'll speed up under the MAHA movement. So to kind of bring everything together here, roles of nonprofits. People like, we have the PBM Foundation. The big granddaddy of them all is WALT, World Association for Laser Therapy. They have meetings every other year. The last meeting happened last year in England, about 450 people from 20 countries. This is a true international movement. Australian Medical Organization in Sydney, again, this is Ann Liebert, and we work hand in glove with them. And so the key is that what do nonprofits like us do, like Walt do? Well, first of all, we aggregate. If you have 80-some papers a month being published, they're the good, the bad, and the ugly. You have some that are poorly written, the clinical trial or study poorly designed, poorly documented, poorly reported, and then you have these incredible studies that everything's done right, large enough patient grouping, everything documented, and how do we take the best of the best and pull them together and curate them, find and get them out there for not only other researchers to see so we can have collaborative research, but how do we get people to into the lay world, into the policy world. And that really gets into what I call the advocacy echo chamber, that every one of us in this room and all of our friends, we probably watch podcasts, some of us may have podcasts, we write op-eds, letters to the editor, we talk to each other, we have social media. We need to be promoting this. And I call it the echo chamber because there's those people out there, whether it's a commander at a base, whether it's somebody in Medicare over in Baltimore, whether it's somebody at the Martinsburg Hospital. We need to get the science and the evidence in front of them as many ways as possible so that they will someday wake up and say, maybe I ought to try that. There's no downside, could help, won't hurt. We've been doing a lot of work on this in raising awareness. We've had some amazing briefings on Capitol Hill, hearings on Capitol Hill, demonstrations. We've actually broken into the mainstream media. There's been front page articles in the last year in the Wall Street Journal. Sunday Guardian of India, myself and several of our other colleagues are writing regular articles in that field, and USA Today had a big article recently. And the main thing is we use hashtags. I practically live off of Facebook outside of my normal world, and coming up with hashtags that, again, allow that aggregation, allow that sharing is an important piece. So to conclude, some of you may be old enough to remember good old Buckminster Fuller with his geodesic domes. And one of the things he came up with, he was one of the great futurists of the 60s and 70s, was he said that as he studied some of the big ships, and we're talking like the big ocean liners or tankers, and nowadays the container ships, you don't have one big rudder that turns the ship because that'll rip the rudder off. You have a smaller rudder called the trim tab that starts the process and moves it. So a little thing creates a big thing. And so that's really one thing that Buckminster Fuller brought up and I bring up. We're all trim tabs. That next peer-to-peer, that friend who says, hey, I was just in an accident and I'm trying to figure out what to do about it, bring up red light. So with that, PBM Foundation is here. We have a great home and friends here at Shepherd University, but also we are worldwide. We have, again, even our board is from five different countries. So we're here to help. We're here to help share information and also to hopefully get people the treatments they need. So with that, I will turn it over to the questions.
Okay, so our first question is,
Hello. Oh, wow, sorry. Does the PBM Foundation website offer the most comprehensive information, like clinical trials?
Yes, it does. What we tried to do was to find the best of the best. So if you go on to, again, pbmfoundation.org, there's an area called Areas of Study, and it's divided up into 14 different areas where by medical condition. And what we try to do is every month we update with some of the latest published clinical studies for those particular areas. So whether it's oral mucositis, whether it's age-related macular degeneration, whether it is neurological issues. We actually have 3 different areas of neurological: Parkinson's by itself, brain injury by itself, and then neurological in general. There's a whole area in wound healing. So we try to find the best, and again, what we do is, because there's a lot of animal studies and Petri dish studies, which are important, but we only put in human studies so people can say, okay, these 30 patients or these 200 patients were treated with PBM in this way, and here is the results. So if you want those kind of deep dive, 30, 40-page clinical papers, they're on our website. We also have an area called PBM Basics, which has videos of what is PBM all about and some of the history of it. We have a wonderful Andrew Mester, who's the son of Andre Mester, has a wonderful video about how his father did the mice studies and all the rest. So all that's on our website, and it's definitely a go-to place.
Can patients with MS or ALS be helped with PBM?
Yes, they can. It's early on. It's still anecdotal. The clinical trials have not really been there, but strong anecdotals. And again, Ann Liebert out of Sydney has probably been the most dynamic and most effective in treating ALS and that. Also, I'd say Lou Lim out of Toronto is probably another one that's been working on it, as well as Tom Kerber out of Canada. So there's a lot of people out there. We have not published ALS studies on our website yet, but it is a growing area, thankfully.
Thank you. Can you say more about the colitis treatment device? Any clinical trial opportunities for this?
Yeah, it's basically still in the prototype stage. They were showing it off in London last year, and it's really something. I mean, for those of us who remember the old movie Fantastic Voyage, when I first saw it, I said, "Is Raquel Welch in there?" But it has 4 LEDs, and you swallow it, and it goes through your system over 3 days, and it gets to the colitis area and it treats it. And it's still anecdotal, it's still prototype, but they are very optimistic that because you can't fully penetrate a human body from the outside, it's time to start trying to get it into the inside.
Do you know if there are any clinical trial opportunities?
For that or for anything in general?
For that, I think, yeah.
That, again, what I could do is put people in touch with that particular company in Israel. I mean, the thing is one thing we don't have is a full clearinghouse of clinical trials underway for PBM. That would be, basically we need a few more people to do that, but we can at least put you in touch with the researchers who are doing those clinical trials, and we have some amazing ones. Again, our hubs in the United States are Boston, Shepherd area, and then Denver and Salt Lake City. We also have this Toronto. We have a great center in Sydney. We have a great center in London. So there's a lot of opportunities there to put you, if you have something where you'd like to participate. One of the things that we were able to do going back the last couple of years, the FDA was very, very, let us say, bureaucratic about dealing with clinical evidence. And over the years, we've gotten them to do 3 things which were groundbreaking. The first one was having them understand that as long as the clinical structure of that clinical study or trial met certain standards, it could be done anywhere in the world, because they were very U.S.-centric. I even shamed them into saying, we got you at the University of Buffalo, and across the river in Hamilton, Ontario, they're doing the same study. Why aren't you letting them do it there too? And they said, well, because it's not U.S. I said, but if it's the same study, if it's the same group of doctors. So we shamed them into finally saying, if the criteria and design is the same, you can do it in India, you can do it in Brazil, wherever. The second thing is we were able to get them to be collaborative. Up until a couple of years ago, the FDA would basically sit back and wait for you to come to them, and then they'd go up and down on a clinical trial. Now they're collaborative. They want people to come in advance and say, this is what I'm planning to do so I can get an indication for use, and they will work with you. Collaboration was never there before. The third one is that so many of the treatments, because they're now LEDs, it used to be a lot of things were laser. Now almost all are like 80% are LEDs, which means that people are taking these devices home. They're inexpensive, they are easy to use, and I mean most of them have self-timers. So the VAs in particular, and some of the hospitals, especially in Boston, and even the Wellness Center, they're handing these things out and say, use them at home. And so the result is that the FDA just last year finally embraced real-world evidence. So this is another huge area for the scientific community to finally reflect the reality of home-based care and holistic care. So these are major breakthroughs that take a long time to do, but we got them through.
Thank you. Do they have any use for increasing bone density?
That I would have to defer to the scientists. What we have found is it has increased cartilage. So we have anecdotal evidence for someone who's maybe tracking toward a knee replacement, that if you start putting this red light on it in advance, you can slow down or even avoid knee replacement because the cartilage is being rebuilt by the red light. Again, anecdotal, but it's happening out there.
Do you have resources for helping to identify worthwhile or effective consumer devices?
We, at this point, we've started a testing process to try to, not necessarily a good housekeeping seal of approval, but saying, hypothetically, if you have a 20 watt light bulb and you flip it on with a light meter, yeah, it's 20 watts. The same thing with PBM devices. If they say they provide certain amount of dosage at certain nanometers, we've got the capability with two companies, both of them work with the Defense and NASA, to test devices. We're in its infancy, but that's what our hope is that we'll be able to get the wheat from the chaff and have consumer devices certified, at least as far as their delivery goes, so that the consumer out there who wants that under $500 or under $200 device will know what they're getting.
Is there any research you know of that is looking at preventing cancer reoccurrence?
No, not PBM related. Now, there's a whole nother area called photodynamic therapy, PDT, and a number of our scientists are working on that. And what that is basically you're pairing a cancer drug with PBM to basically enhance the effectiveness of that cancer drug. And we are shrinking tumors. We're shrinking prostate cancer tumors. We're shrinking breast cancer tumors. So the PDT, which is, I said, PBM in consort with a cancer drug, is working, and some of these studies are in their early phases, but the anecdotals are very strong.
Thank you. Is it useful to treat autism? And if so, what benefits result from its use?
It's early stage. Again, I would defer to someone like Ann Liebert who's doing work on it, but that's another area that all these neurological things are, except for brain injuries, are still fairly early on.
Okay, just reading this one. Nope, I'm going to go to the next one. Could PBR be used to treat people with cholesterol and blood pressure issues?
At this point, the main thing that it does is that many people want to exercise, and they go out there, whether it's the weight room here at the wellness center or they're jogging at home, and they get sore. And all of a sudden, their zeal for exercise kind of diminishes. If you're taking PBM as a precondition, you're not going to wake up the next morning and say, why did I jog those 5 miles or whatever? And so why did I put that additional disc onto the weight? And so what's happening is it helps people exercise more, which helps them lose weight, feel better, reduce cholesterol, all those kind of issues. But no direct issue, but it does help, again, the wellness environment.
Okay, I'll ask you this one last question, and then I'll hand you the rest for you to review later. And you're all welcome to ask him your questions in the dessert reception afterwards as well. This one is PBM in the same family as other beneficial light sources, such as early morning light, or conversely, the downside of dark winter days? Are they different branches of the same tree?
It's different branches. I mean, you look at the entire light spectrum, and for a while I was advising a number of food processing companies like ConAgra as well as Hershey, and they're using the ultraviolet end to take care of listeria and other bacterial issues. So when you look at the whole spectrum, every part of the spectrum has some benefit. That's why we go out into the sun. But in this case, it's just the red, near infrared, and it's a so the issue there is that we just different parts of the light spectrum have different benefits, but like in the case of ultraviolet, they can be very harmful. So the beauty of red and near infrared is you can literally, it's almost a point of diminishing returns. After 15, 20 minutes, it's not going to help you anymore, but it's not going to hurt you. I mean, we've had friends who have, and colleagues who fall asleep in one of our light beds, and no big deal. It's not like falling asleep in a tanning bed where you'd be fried. And so one of our colleagues, it was so funny, with a quick story, he was flying back from Australia to London, and we were on a conference call, and he got into the bed to kind of work out the kinks from this long flight, and about 10 minutes in, he starts snoring on the conference call, which was fun. But the beauty is that it doesn't harm you. I mean, again, it's all about throughput. How long do you want to? I mean, like my wife Vicki and I, we'll sit there watching TV, and we'll put the light things on us while we're just watching television to take care of whatever ailed us that day. So it's so the beauty is that it's very effective, and it's cost effective in most cases, and it certainly is safe. That's why it should be everywhere.
Thank you. I hope you all join us outside.
Thank you. Pleasure. And I'll join you with dessert.
Here's all your questions.
So hopefully that went well. I didn't see anyone falling asleep. So. Got it now? No, I'm not seeing the top. We're using